Welcome to Mulready Minutes with Oklahoma Insurance Commissioner Glenn Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep and look at what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Welcome to another Mulready Minute Podcast. We have with us a special guest today, someone I've known for quite a while. We haven't seen her in a bit, but brings just a wealth of experience to this topic that is on the edge of insurance, but certainly very pertinent to the state of Oklahoma. So Buffy Heater, who is the Chief Strategy Officer at the Oklahoma State Department of Health. Welcome, Buffy.
Thank you so much, Commissioner. And I was thinking it's been many years since we've worked on initiatives together, and so pleased that you gave me this invitation to be able to share a few thoughts with y'all this morning.
Here we are again. Let me read your bio, but forgive me for just reading, but just to make sure folks know just what a special guest you are. But Buffy is as I said, Chief Strategy Officer at the Oklahoma State Department of Health, has over 25 years of experience in Medicaid, public health policy, and program implementation. Joining the Department of Health in 2017, she became Chief Strategy Officer in 2022, overseeing transformation, business performance, project management, and technology strategies. That's kind of intimidating. Buffy holds a bachelor's from Northeastern State University and a master's in public health from OU. She has held leadership roles at the Oklahoma Healthcare Authority, Governor Fallin's Health and Human Services Cabinet, and the Department of Health, where she co-led Oklahoma's COVID vaccine rollout. Outside of work, she enjoys Oklahoma lakes, flowers, and butterflies with her husband and 4 daughters. And earlier we were laughing about she needs a savings plan like a 529 we have for education, but needs a wedding tax savings program with 4 daughters. So good. Buffy, good to have you with us. Today we're going to talk about Oklahoma's health. Or lack thereof, maybe is more appropriate. And so you've been heavily involved in those different initiatives and sort of pressing public health issues and wellness. Talk to us about what is happening with Oklahoma. What's our current status?
Well, whenever you talk about Oklahomans' health status, let's kind of define that, break that down a little bit. Health status of Oklahomans can be any realm of things, right? We usually think about physical and medical health, our quality of life and the ability for us to engage with others and our workplaces and our families and our churches across the state. But it's really also an emotional and a mental health. We can look at it through a lens of spiritual health as well as socioeconomic health, right? So there's many different ways that you can look at health status. Health status also can be looked at through a couple different levels or layers across Oklahoma. So when you think the state as a whole, right, across Oklahoma, we know that across the nation we're ranked 47th in health right now. America's Health Rankings puts together a variety of different categories by which they look at different metrics and indicators and things like that. And so from a statewide perspective, we know we're not doing so great, right? Number 1 in health for America's Health Rankings is best. And so 47th, we're coming up at the bottom, unfortunately. But we also know that our local communities, the cities, the counties, the zip codes that we live in, they also have their own kind of regional or cultural, their regional flares for health status, as well as at the individual level. We know that health is very personal. The behaviors that an individual entertains are going to contribute to their positive health or perhaps lack thereof. So we know that all those things combined really make up an individual's health status and really make up the lens for Oklahoma.
Yeah, and so let me ask you a quick question. We're at 47th. Have we arrived there quickly in the last couple of years? What has it been like historically in Oklahoma?
Yeah, so in Oklahoma, it's kind of unfortunately been a slow race to the bottom. So whenever we look at our health status ranking back in 1990, when America's Health Ranking first started putting out their state-by-state comparisons, in 1990s, Oklahoma was kind of in the middle of the pack, right? We ranked 32 at that time. Fast forward to just 10 years ago, right? So pre-pandemic, kind of in the mid-2000s, Oklahoma ranked 43rd. So now we've kind of competed, unfortunately, around that bottom slot, 45th, 46th, and now at 47th. From a state standpoint, we want to make sure that we're setting attainable goals. So we really feel like with a couple different policy levers and changes to an individual's behavior, we're really trying to strive to regain that footing that we had 10 years ago and move us from 47th back up to 43rd in terms of our health rankings. Now, in Oklahoma, we recognize that while Oklahomans may have held kind of the status quo for quite a bit of time. Other states may have had more sizable gains, right? So it's not necessarily that Oklahomans are doing things wrong or that we're taking a step back.
Sorry to interrupt. That was going to be my follow-up question. Has Oklahoma slipped or others have gained? And what do we attribute that to? Have other states invested more money, resources into that area? What do we attribute that to?
So I do think there have been some policy decisions across the nation where other states have maybe been more aggressive or have taken up some options earlier than Oklahoma. So, for example, one of those things is our access to care and insurance coverage, right? So we know that Oklahoma historically has had an uninsured rate that, goodness, when you and I met probably 20 years ago, our uninsured rate was probably 17-18%. With some of the federal initiatives and also the focus at the state level to have affordable insurance coverage, having more options available for individuals. Here in most recent years, we were able to bring that closer to 14%. At this most recent year, Oklahoma is around 11% uninsured as of 2023. Across the nation, that national average is about 8%, right? So Oklahoma's made some terrific strides in the coverage and the access to care. However, other states have made strides that are a little bit more ambitious than Oklahoma has. So say when Oklahoma adopted Medicaid expansion just a couple years ago, we may have been 8 or 10 years behind other states that had already gotten a footing ahead of us. So that's part of what's contributing to Oklahoma being able to have a rank of 47th. We've been a little bit slow to the table on some of those different policy levers.
Yeah. So obesity, high blood pressure, diabetes. Unfortunately, we are leaders in those categories. Yeah. What do we do about that? How do we impact that as a state from a public health standpoint?
Yeah.
How do we address that?
Well, in public health, we really talk about the costs of chronic disease for the state, but we try to kind of boil that down into we've got 4 modifiable high-risk health behaviors, right, that really contribute to the lion's share of chronic diseases across the state. So things that you're talking about with obesity, when we talk about tobacco use, sedentary lifestyle, poor diet, lack of exercise, things like that. Those are certainly contributing to our high rates of obesity across the state. Oklahoma, unfortunately, is ranked 48th out of 50 states in obesity. We have, over 1.5 million adults that are in that obese category. And we know that obesity ties directly to chronic diseases that are resulting in higher healthcare costs and lower quality of life for individuals. Some other things that we see related to obesity, we have diabetes, right? Diabetes is the 8th leading cause of death in Oklahoma. We're currently ranked 41st out of 50th in the states with diabetes. We'll also say that diabetes, in terms of our health expenditures, the state is spending about $1.6 billion in care and treatment for individuals that are living with diabetes. So in terms of a condition that has a large, not only a health impact, but an economic impact, we know that's one of the major chronic diseases of concern. Heart disease is another one, right? Whenever we look at the number 1 leading cause of death in Oklahoma, heart disease is at the top of that list, all linked to those modifiable health behaviors, right? So, when we're looking at the things that, say, Oklahoma is ranked upon, things that are contributing to that ranking of being 47th across the nation. We know that metrics such as the amount of exercise that individuals are getting. Are they spending 2 to 3 times a week, with 90 to 150 minutes of vigorous physical activity and exercise? Sufficient sleep, fruit and vegetable consumption is another thing. One of our surveys asks about do adults or do families, are they consuming a serving of fruits and vegetables each and every day, 7 days a week? Unfortunately, there are families in Oklahoma that can't say yes to that question. And certainly with Oklahoma being an agricultural state where we cross every quarter and see our farmers markets, things like that, that's something by putting that awareness out there and putting putting mechanisms in place by which folks can go and be able to pick up those things and be able to change that answer to say, yes, they understand the importance of consuming fruits and vegetables every single day. That's kind of a relatively easy behavior change that we hope to see made in the coming months and the coming years as folks recognize the importance of that type of behavior.
Yeah. So you mentioned cost as far as just, I think, $1.6 billion. That just brings into the conversation, I think, something that a lot of people don't even think about when it comes to health status, and that is just the overall economic impact. Even if you're cold-blooded and don't care about someone's health, the economic impact of that really should incorporate everybody into this effort to improve our status.
Yeah, absolutely. And when we talk about the burden of chronic disease on Oklahomans, it's not only that impact on an individual's life and their quality of life and their livelihood, but it is hitting their pocketbooks, right? It's also hitting our health systems, right? With a percentage of the population that's uninsured, folks that may show up in emergency rooms or perhaps have hospital admissions that are preventable, right? Otherwise preventable. Those are things that are contributing to that cycle of just the economics of the healthcare in Oklahoma. When we look at chronic conditions, there are 5 chronic diseases that are really closely tied to those 4 modifiable health behaviors that I just mentioned. And those are cardiovascular disease, cancer, diabetes, chronic lower respiratory disease, and Alzheimer's. And those 5 chronic diseases at last tally made up 90% of Oklahoma's healthcare costs. So it's an amazing amount of time, energy, and resources that are being dedicated to treatment of individuals with those chronic diseases. In Oklahoma, we know that 14% of Oklahoma adults live with multiple chronic conditions, right? So in Oklahoma, that rate is 14%, whereas across the nation, we've got about 11%, right, that have multiple chronic conditions. So in Oklahoma, we're a complex community, right? Not only, I think, in our interests and our livelihoods, but also in our healthcare needs. We're spending a lot and needing a lot of treatment for those things. Whenever we talk about obesity and the economic impact of obesity, the chronic diseases associated with obesity really in our state are amounting to over $1 billion a year, right? So huge economic impact and really, trying to take a look at the quality of life for individuals. How are they able to access care? Is that high quality care? And then eventually being able to find resolution.
Yeah. Bobby, let me bring a term into our conversation here that gets tossed around a lot. And I bet there's probably a number of people watching or listening to this that don't even know what that means, but social determinants of health. We hear that a lot. There's been numerous studies on a very specific one years ago done in Tulsa that really had to do with different zip codes, that sort of thing. But regardless, what is social determinants of health, and talk about how that plays into this whole equation here in Oklahoma? Yeah.
Social determinants of health are as it sounds, right? It's those things that are non-medical, non-clinical that contributes to a person's health. So it's things like having access to adequate shelter, right? Being able to have good housing options, clean, fit, and well-insulated housing options to keep a person well. It's also access to things like transportation, right? Having a car. If you don't have a car, being able to have access to a local transportation system, a bus system, something like that, to be able to get you to those places that you need to go.
Oh, and without transportation, it's hard to have a job. Without a job, it's hard to have insurance. Without insurance, it's hard to get health care.
Absolutely.
So this whole equation, if you will.
Absolutely. And so another factor of social determinants is the socioeconomic health status or socioeconomic status of an individual. Are they able to get to a job? Do they have physical health that enables them to be able to work, right? Yeah. A regular full-time job and be able to make that earning. We also know in that socioeconomic status, the educational attainment. is another one. Are they able to be successful in school? Have they been able to pursue something post-secondary, right? Whether it's technical school, training program, college, university, things like that. We know that educational criteria also plays into a social determinant of health. Some other things that we talk about are like access to healthy foods, right? Healthy foods. Can they get to a grocery store? Is there a grocery store in their local community? Or are they looking at, perhaps a convenience store or quick foods that maybe
junk
doesn't
food
have?
is cheap.
That's right. And easily accessible, right? So you look at things like how far of a drive is it to get to a high quality grocery store, or to be able to get, fresh produce and vegetables and things like that. Whenever we talk about especially, older adults, isolation, right? And the mental health and being able to have a social network, that also contributes to those social determinants of health, right? You can have all of your medical needs taken care of, but if you're alone or lonely, that certainly puts a damper on someone's ability to truly thrive. So social determinants is multifaceted. At the health department, something that we've tried to change our terminology a little bit, we call it social drivers of health, because that word determinant kind of implies
sounds final,
a foregone conclusion. Yes, absolutely. So, as we try to look at a human psychology and being able to change health behaviors, or being able to do things in a different way, it requires someone to be hopeful, right? And to be positive and to kind of have that outlook for the future. And so instead of using social determinants, we've used social drivers of health. So it means that although an individual may experience in their life or in their living situation, they may have great hardships, there are protective factors, right? That perhaps they have a support or an ability to be able to connect with others, to be able to find resources, right? There are some of those protective factors that'll help insulate someone from having a foregone conclusion of having a negative health impact. And so that's why we call it a driver. It's there, and it's something that needs to be reckoned with, but it's not insurmountable at the end. So
I like that change of words personally. Yeah, that is good. Hey, as we prepare here to wrap up, I might combine a couple of questions. I talk a lot about creating a culture of blank. So, we've talked a lot recently. We've had a program going about Oklahoma roofs and strengthening Oklahoma homes, and creating a culture of resilience and mitigation when it comes to property insurance. Talk about creating a culture of insurance, even just people value that do you need flood insurance? Have you looked into flood, that sort of thing? How do we as Oklahoma create a culture of health and wellness? I guess I'd ask that question kind of coupled with, as strategy officer for the Department of Health here, what initiatives, anything coming in the near future as far as strategic initiatives, that didn't quite roll off the tongue, did it? Strategic initiatives to do that, to create a culture of health and wellness, or what's on the horizon?
Right. Well, I mentioned a little bit that term hope, right? So at the State Department of Health, we want to make sure that we're trying to promote the concepts of health, and to really let Oklahomans believe that they can become healthy, right? That it's all of our jobs as individuals.
It's not predetermined.
That's right. All of our jobs as individuals to make sure that we're making the right choices and trying to pursue those right behaviors that will contribute to an overall better health. So at an individual level, I think it's that promoting that hope and that belief that Oklahomans can make a change, and they can be healthier. I think all of us can recognize, certainly myself, I can get more hours of sleep every night, right? So it doesn't have to be a large undertaking. It's the small steps. And with that comes that positive affirmation that we can make a change and do better each day and each week. At the community level, and when we talk about our health systems, I think there's also opportunity here to make sure that our health systems are creating pathways to incentivize and to reward folks that are trying to do the right thing. right? So whether through the individual incentives that could come about, and also for some payment reform, right? To be able to come in and to be able to telehealth plan, have a payer, have a health system, be rewarded for being able to help individuals meet them where they are and help individuals attain that better health status. Those are things that certainly should be on the horizon for Oklahoma going forward.
Good. Well, that's helpful and a good way to, good way to wrap up. So, Buffy, thank you again for being on and taking some time out of your busy schedule to be with us. Those are some, I don't want to say depressing, but they're not really encouraging numbers, but there's ability to make progress. And thank you for what you're doing at the Department of Health and for our state to bend that curve, if you will, and get those numbers at least back up to the middle, right? So
yes.
Good. Thank you for being with us. Appreciate it.
Thank you.
Okay.
Mm-hmm.
If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about on this podcast. Until next time, take care from the Oklahoma Insurance Department.